Hi, and welcome to UBC's Next Big Thing. I'm Rosemary Jean Thompson. My guest is Dr. Joan Bottorff. She is the director of the Institute for Healthy Living and Chronic Disease Prevention. Welcome, glad to have you here.
Thank you.
Tell me a little bit about the Fathers That Smoke kind of project.
Well, we began several years ago looking at trying to find ways to support women's tobacco reduction during pregnancy and postpartum. And in the course of that research, we learned that many of their partners were smoking, which, as you can imagine, made it very difficult for them to reduce and stop smoking at that time. And so we decided to start talking to fathers about their smoking and discovered that many of them actually were thinking about quitting. As healthcare providers with young families like that, we're so focused on mothers and babies that we totally ignore fathers. They were there out on their own, thinking about stopping smoking, but not knowing quite how to do it. And so that's what launched this whole program of research that we've undertaken. We've talked with fathers about what might help them in terms of reducing and stopping smoking. As they have these new babies in their arms, they're reflecting on what kind of father they want to be. Most of them realize that a smoking dad is not the ideal dad. They really do begin to get motivated to reduce and stop smoking. And so because they really position themselves as fathers and not as smokers, we've called our program Dads in Gear, partly to really recognize fathering and the importance that it is. And also we learned that many men were realizing that their smoking was being frowned upon by others, and they were feeling stigmatized in many situations because of their smoking. And so we didn't want to include smoking in the title, and we wanted it to be a bit masculine. We thought this name Dads in Gear might actually capture men's curiosity and be acceptable to them.
So in a short period of time, can you describe the program and how fathers can get involved with it?
We've developed 3 different resources, all based with the input of fathers who smoke or have recently quit. We've really depended on their advice and assistance in developing these resources. So the first thing that we developed was a booklet called For the Right Time, for the Right Reasons. Dads talk to other dads about reducing and quitting smoking. And it's a motivational tool. And that booklet is being printed throughout BC and is available in most public health centers. We've also then developed an 8-week group program. And this is still in the development stages, but men told us they actually wanted to meet with other men face to face to help each other quit smoking. And so we did a pilot and developed the program, and the men responded very, very favorably to it. We thought, well, maybe we have something here. And so to begin to be able to launch it in several communities, we realized we needed to develop the resources we used in the group a bit more and make them more accessible. We did a bit more work and again engaged fathers and developed a website with resources that will be able to help fathers, we think, quit smoking. And the resources are in 3 areas. One is around fathering, because we know that men want to be good fathers and we want to support that. And also we think that it'll strengthen their motivation for cessation. The other part is around healthy living, and it mostly focuses on exercise. And it teaches men the kind of exercises they can do with their babies, because they do want to stay fit to play soccer with their kids, but we also know that exercise is a good stress management strategy. And men told us that it was really stressful being a new father, and that was one of the reasons they needed to continue smoking. And then a third component is some resources around reducing and stopping smoking. And again, we don't give men 10 steps, because they told us that they actually didn't want to be told how to quit. They want to make up their own minds, and they want to decide when they're going to quit. So we provide men with many ideas about different ways that other men have quit smoking. There's some testimonials of a couple of new fathers who quit that men also, we think, will find helpful. And so with this package of resources together on the website, again called Dads in Gear, we think that it could be a useful self-management resource for men who want to reduce and stop smoking on their own. But more importantly, we think it'll also be a useful resource for group programs once we have those launched in the community. If we could help fathers reduce and stop smoking at this early point in their life, we could prevent quite a large number of cancers, heart disease and other chronic diseases that men often get. But we could also support women's tobacco reduction. We could provide more smoke-free homes for children. You know, by focusing on fathers, we actually can contribute to family health, I think, in a really important way.
Thank you for being here, Joan, and sharing that with us.
Thank you.
And we look forward to seeing you next time on UBC's Next Big Thing. Bye for now.